Today I'm going to give you a general concept talk focusing upon the goals of vaccination and vaccination programs. But as I begin and give you an introduction, I want to talk about some of the basics of a control program. And when you design a control program for avian influenza, you need to take into account the three different outcomes with which you wish to achieve. One can be the prevention of the infection or the disease. Number two, if you have it, the management of that disease to reduce the economic impact that can be negative. And number three, an outcome could be eradication, which is total elimination of that virus or that disease from either commercial or non-commercial birds. To achieve these outcomes, we have to use a variety of control strategies that we combined in those programs to make them effective. And there are 5 basic strategies that can be components of these control programs. One, biosecurity, which is methods by which we include or exclude the movement of that virus on or off of farms or premises, and that could include such things as quarantine. The second one is a good diagnostics and surveillance programs. That would tell us where the virus is at any one time. Third would be elimination of avian influenza infected poultry. And the fourth one would be decreasing host susceptibility to the virus. And by far the most important of these is number 5, which is education, which is educating all people involved in the poultry protection segment, from the farmers to the feed suppliers, to the government, even to the executives of companies involved in those programs. By educating, they would know what their role is in preventing or controlling or eradicating avian influenza. We must remember in disease control that vaccination can only be viewed as a single tool in a multi-procedural strategy. If we do not include, or if we lack proper biosecurity, we don't have good diagnostics or surveillance, we don't have an education program, and we don't eliminate infected poultry, the result is an avian influenza control program that is doomed to failure before you begin. When we look at some basic disease concepts, there are various outcomes we have to look at, and one of them is exposure. And it's quite obvious there are only 2 choices, is either no exposure or exposure. With no exposure, because of the lack of the virus exposing to a susceptible host, there's obviously no infection. But even if there is exposure, you may not get infection. For example, if that virus is adapted to a wild bird species, exposure to domestic chickens may not produce infection because the virus is not adapted. Or if you have a low exposure dose or an inappropriate route of exposure or have excellent immunity, you may get no infection. However, infection could be one of the results of exposure, and it could be varying from low to high efficiencies of that infection or that replication. In this case, an outcome could be infection with no clinical disease. Usually there is some adaptation of that virus to that host species, and either inadequate or no immunity. This could be followed by exposure and infection and even disease production or pathogenicity, which could be a mild disease or a severe disease. It may depend upon various factors, including adaptation or the absence of immunity. Transmissibility implies by the term that the virus has natural host-to-host spread. Now, as we look at each of these 5 components in the control program, they each have individual contributions to the avian influenza control. One, biosecurity is very important because it prevents exposure, or at least reduces exposure, of the susceptible host to the pathogen or avian influenza virus. Diagnostics and surveillance are very important because they give us knowledge of the location of the avian influenza virus within that population or within that particular region or compartment. It also tells us if the infection is widespread or very rare, i.e. the infection rate in the area. And it can be used as an assessment tool to tell us how successful our control program is. Elimination of infected poultry is a very critical part. It stops the source of the avian influenza virus that seeds into that geographic region. Fourth, decreased host susceptibility prevents infection or disease. That's generally done by vaccination, although host genetics could play a role in the future. And finally, the 5th component, the education, helps people understand what their role will be in preventing infection and how they can stop the process of movement of this virus. So how does avian influenza virus affect poultry? This is basic for us to understand and develop and formulate goals. Number 1 is you have to have exposure, as we've already mentioned. And when you have exposure, if you get infection, then you will have replication of the virus in the respiratory tract and shedding of that virus back into the environment from the oropharynx or shedding from the cloaca with replication in the intestinal tract. This results in environmental contamination from the oral secretions that have the virus or from the feces that have the virus. And finally, with high pathogenicity avian influenza viruses, there will be contamination of the carcass of the bird that could be a source of spread by cannibalism. So when we look at the impact of avian influenza vaccination on transmission, one of the primary goals is reducing environmental contamination. And by doing that, what we're doing is we're preventing contamination of the water, of the air, of the clothing and shoes of people. We're preventing infected birds from coming in contact with naive birds and preventing contamination of equipment. And by stopping that part of the process, we eliminate the exposure of susceptible birds. The second impact vaccination has is by increasing resistance of the bird to prevent avian influenza infection, or a shield around the bird from its own immune response that then prevents the infectious process. So more specific general goals that would be seen with vaccination are prevention of infection by increasing birds' resistance to avian influenza virus. The second one would be prevention of illness and death, which is a positive economic result as well as a humane result. Third, by good immunity, we decrease avian influenza virus growth in the respiratory and the alimentary tracts. Therefore, we decrease the shed into the environment, and therefore we reduce environmental contamination. As a result of the reduction in avian influenza environmental contamination, we decrease the transmission to birds on the farm, as well as decrease the spread between farms. And the final goal, by reducing the H5N1 high-path avian influenza virus shedding, we also reduce exposure to humans and produce fewer human cases. So some of the basic questions about vaccination is, how does avian influenza vaccines work? First, how do they produce protection? And really there are three types of immunity that are involved in this protection process. One, and the most widely recognized, is humoral immunity, but also cellular immunity and the innate cellular immunity are involved in this process. By far the best information we have available shows that antibodies against the hemagglutinin protein are the most protective, although antibodies against the neuraminidase protein are also protective, but somewhat less effectively. And these antibodies are protective against that specific hemagglutinin or neuraminidase subtype. We know from many experimental as well as field studies that the protection afforded is very type specific, therefore there is no single universal vaccine that can be used against all avian influenza viruses. That is to say that historically, in the field as well as experimentally, the protection is based upon protection against a specific hemagglutinin subtype. Therefore, vaccines are used and developed based upon which hemagglutinin subtype is the most likely for exposure. Because avian influenza virus infections involve initiation of virus growth in the respiratory and the alimentary tracts, thus the concept of a sterilizing immunity is not really achievable in the field. Just for example, you can look at other respiratory viruses, not only in poultry but other animal species, and see that generally those vaccines reduce the virus growth, but they are not preventative completely of virus replication, which emphasizes the need for biosecurity to prevent cross-contamination and movement of viruses. Therefore, biosecurity enhancements are necessary anytime you use vaccination as a control program. But there are some cautionary points we must discuss and understand. Vaccination is only that single tool in an avian influenza control program for very specific reasons. One is that the vaccination process itself, the usage of a vaccine, can interfere with both the active and passive surveillance programs unless that vaccination and surveillance program are co-developed and properly designed and implemented. Second, the vaccination, if used in the field, can hide clinical signs of avian influenza infection. For example, highly pathogenic avian influenza, which would normally cause high mortality in chickens. In vaccinated flocks, you can have infection, but without the high mortality. Therefore, this would eliminate clinical signs as a primary screening tool to identify presumptive highly pathogenic avian influenza cases for further diagnostic evaluation. And finally, vaccination can impact international trade if it's not done properly. And therefore, any time a vaccination program is under development It should be done according to those guidelines developed and published by OIE and FAO to assure that the surveillance will adequately detect infection in vaccinated flocks. To emphasize, avian influenza vaccination must always be done properly in the proper context of the risk as well as the proper context of how the application is in the field. But before you vaccinate, you must plan ahead. You must analyze the situation, determine what is the avian influenza status of that country, zone, or compartment. For example, is the infection endemic? If it's an endemic, there will be a continual source of avian influenza virus, and therefore the need for vaccination may be greater than, for example, if it's an active outbreak where you have focal source of avian influenza that you can pinpoint and eradicate by only stamping out programs. Finally, if you have no avian influenza virus present in that country, zone, or compartment, then you have to look at it as a preventative measure and determine what's the risk of introduction and how effective will vaccination be as a preventative. For example, if it's in high-risk areas, such as in poultry outbreaks adjacent to a border in a country where there is a porous movement of animals, then it might be of value to consider that in developing a preventative program. Or if it's in countries where you have wild bird infections, then it may be of value to reduce the risk by vaccinating certain poultry species. However, in the cases of where there's low risk, where there are no cases in poultry within that particular company or country or within their neighbors' countries, then there may be no need to do vaccination as a preventative. And those risks have to be weighed and analyzed. Also, how will vaccination impact diagnostics and surveillance? In this case, vaccination will eliminate the detection of high mortality as a signalment for a diagnostic investigation. Therefore, you must develop additional strategies using the DIVA concept, differentiating infected from vaccinated animals, to be able to detect infection in those vaccinated populations. And there will be additional presentations on this more specific strategy. In this case, these DIVA strategies, they could use serological strategies or they could use virus detection strategies through a variety of means. And how can this vaccination program be done properly? Well, it has to involve correct vaccines, both in the quality and in the type of vaccines. They have to be properly transported and properly stored. And then finally, they have to be administered properly by a correct vaccination technique. How can avian influenza vaccination be used correctly? For example, one way is vaccination can be used as a tool during an eradication program. Generally, there are two concepts that are discussed about using in vaccination programs. One is a ring vaccination program, which is a general concept used with other foreign animal diseases, and that is vaccinating in a surveillance or buffer zone outside of the quarantine or the outbreak or infected zone or compartment. This actually is quite difficult to use as a control measure with avian influenza and some other diseases unless you can for sure develop a strong quarantine zone so that you do not have birds or animals moving across that buffers or surveillance zone out to an outer side area. To practical uses, a much better way to use vaccination as part of an eradication program is to use it in a suppressor vaccination concept. And this could be done one of two ways. For example, it could be done in the face of an outbreak in birds within that infected zone to reduce the spread and reduce the clinical disease and reduce contamination. The second way is in eradication zones or infected zones after there has been a thorough eradication done. Birds going back into that zone for repopulation could be vaccinated to increase their resistance to potential outbreaks if they're exposed to residual virus. Secondly, vaccination can be used as a tool in management because the vaccination can decrease the clinical disease and reduce economic losses. Much of the vaccine that's being used around the world for H5N2 high-path AI is being used as a management tool to reduce the amount of virus replication and shedding into the environment as a prelude to eventual eradication down the road. This is generally a type of strategy used where the virus has become endemic in domesticated poultry populations and where the need for long-term control by reducing virus shedding in the environment is necessary. Third, vaccination can be used as a preventative tool. Generally, it's used in areas where there's high risk of introduction of avian influenza. For example, it could be in adjacent countries that have a high-path outbreak and other countries that have porous borders. In this case, you would be protecting poultry populations in the free country if there is movement across that porous border. A second place that it could be examined is areas with detection of highly pathogenic avian influenza in wild birds. And you have poultry that are raised outdoor with potential exposure to infected wild birds. In this case, vaccination could be considered and examined as a possible way to reduce the risk. But even if you do decide to use vaccine, it has to be prioritized to what the risk would be. And there should be a priority level determined as part of the goal of vaccination of where and when to use that vaccine. For example, high-risk populations of birds would be the first that should be vaccinated. In this case, in an outbreak zone, either as a ring or suppressor vaccination should be considered. If the country has a large village poultry sector that has infection, in this case, vaccination may be of benefit in reducing susceptibility to other birds within that population. It also may be helpful in outdoor commercially reared waterfowl in reducing their potential to become infected because of the risk of exposure. A second priority, which would be a little bit lower than the high-risk population, are populations of commercial birds that have a high value, such as genetic stocks of pure lines or grandparent stocks. Because of the high individual value of these birds and the difficulty to replace, replicate them, vaccination may be useful in situations where the risk is high. Thirdly, rare captive birds which may be endangered or threatened species in zoologic collections that may have exposure would be a third priority. A fourth priority may be long-lived domesticated poultry, such as egg-laying birds or parent breeders who have a long opportunity for potential exposure. And at the bottom of the list for vaccination priority would be commercially reared birds that are raised indoors because they have a short life and have a lower exposure potential. So in designing a vaccination program, you have to very closely look at a priority development based upon the risk for individual populations of birds in that country, zone, or compartment. There are various categories of vaccine technologies that can be used and have been used. Some are experimental, some have been licensed and used in the field. By far the most commonly used technology is inactivated whole avian influenza virus vaccines. Also, there are in vitro expressed hemagglutinin protein vaccines that have been experimental to this point. Those that are grown in eukaryotic cell culture systems, either plant or animal cells, or in plants or yeast or bacteria or viruses. For example, a baculovirus that has an influenza hemagglutinin gene insert. The other way is to have in vivo expression of the hemagglutinin protein. This is done primarily by using virus and bacterial vectors. And a variety of vectors have been used experimentally, although of these lists of vectors, only two have been used commercially, the fowl pox vectored system with an influenza hemagglutinin gene insert, and the Newcastle disease vectored system with a hemagglutinin gene insert from an influenza virus. And finally, the other category is naked nucleic acid vaccines. At this point, there has not been any commercialization, mainly because of the cost of production and usage of those are prohibitive at this time. So vaccines that should be used in the field should only be those that are licensed. And there are several criteria necessary in examining if that vaccine is sufficiently good enough to be used in the field. For example, in the licensing process, it should be determined if that vaccine is pure. That is, it's not adulterated and contains only the desired compounds and are consistent in their composition to produce a strong, consistent immune response in vaccinated birds. That vaccine should be demonstrated to be safe so that when administered, it does not produce deleterious effect to the vaccinated host or to the environment that they're in. Third, it should be efficacious. There should be studies done to show that it meets minimum quantifiable protection criteria that shows the vaccine is of value. And finally, the vaccine should be potent. That is, it should have sufficient antigen content or sufficient infectious titer that it will be efficacious when used in the field under a variety of conditions. Now, for example, there are a variety of licensed H5 avian influenza vaccines that have been used around the world. Most of the use has been in two locations, in Central America over the past 10 years against H5N2 low pathogenicity influenza. But also there has been a large number of vaccines used in Asia with the current H5N1 outbreaks. The majority of the vaccines used have been inactivated vaccine strains emulsified in mineral oil adjuvants. There's a variety of vaccine viruses that have been used. Most of them are low pathogenic field outbreak viruses of the H5 subtype that have been used. But also there have been the usage of infectious clone system to generate, through reverse genetics, a couple of vaccine viruses that are to grow to very high titer in the embryonated egg culture system. And we have examples of at least one virus or a series of viruses that have been used that are highly pathogenic viruses produced under high containment conditions. Also, there have been recombinant fowlpox viruses licensed. There are two of them that have different hemagglutinin gene inserts. One of them, the hemagglutinin gene alone, from Turkey, Ireland, 83, and the second one containing both the hemagglutinin and the neuraminidase genes from A. goose, Guangdong, 96. And the final category that has been used in the field is the recombinant Newcastle virus vaccines, of which there are two available. One is based upon a insert from the H5 gene of A. goose, Guangdong, 96, and the other one from a Mexican H5 virus insert. In all these situations, the hemagglutinin gene cleavage site has been altered from a highly pathogenic cleavage site to that of a low pathogenic virus. When we look at licensed avian influenza vaccines, by far the most of the vaccine that is produced and used in the world uses an inactivated whole avian influenza virus. This technology is a very old technology used for over the past 50 years. It's a very mature technology, usually based upon low pathogenic avian influenza virus field strains with the same hemagglutinin subtype to match the field virus wishing to protect against. These viruses are grown in embryonated chicken eggs in a biosafety level 2 manufacturing facility, and then they're chemically inactivated by one of three chemical inactivants: formalin, beta-propylactone, or binary ethyleneamine. Following inactivation, they're then emulsified in a proprietary oil adjuvant system, and then the product is licensed and then used. Occasionally, highly pathogenic avian influenza virus strains have been used for vaccines, but for their use, the manufacturing must be done under high biocontainment in BSL 3+ facilities. Recently, new technology has been developed which allows the development in the laboratory of more optimal vaccine viruses through the use of reverse genetics, i.e. an infectious clone system. In this system, they use the hemagglutinin and neuraminidase genes from circulating field viruses, but usually alter the hemagglutinin protein such that the cleavage site will be made into a low pathogenic virus from a highly pathogenic predecessor. Then the internal part of the influenza virus is composed of 6 gene segments derived from a vaccine strain that grows to a very high titer. Combining that with the 2 field strain hemagglutinin and neuraminidase genes, they produce a low pathogenic influenza virus that grows to a very high titer in the embryo chicken system, thus producing a high antigen mass. By using this reverse genetic system, the advantage is it gives you a better genetic match with your outbreak viruses. Therefore, you should produce much better immunity that will last a longer period of time. There are many positive aspects of using inactivated whole avian influenza virus vaccines, including it's a mature technology with very low unit cost. It's a well-used technology, very familiar by poultry vaccine manufacturers, and there's widespread understanding of proper administration in the field. And these vaccines give good protection. But there are limitations to what these vaccines can do, and those need to be understood in designing programs where they can be used properly. For example, they do require expensive, labor-intensive parental administration, which only is economically viable in economies where the labor costs are sufficiently low. The second thing is the protective response is very dependent upon the antigen quantity in the dose and the adjuvant system. Therefore, the quality of the vaccine and administration is very, very important. And finally, there is difficulty in identifying infected birds by serological tests in vaccinated populations unless the vaccine and the surveillance program are designed ahead of time to detect the field virus and the vaccine not interfere with that surveillance. The second category are the recombinant fowlpox vaccines. In this case, there are 2 products available, one that has an insert of the Turkey, Ireland 1983 H5 hemagglutinin gene, and the second one has the hemagglutinin and neuraminidase genes inserted from A. goose, Guangdong. There are some advantages of this type of vaccine. One is it can be administered in the hatchery where you have advantages of high biosecurity in commercial production companies, and there's high quality control of that vaccine administration process. The other thing is it lends itself more easily to the DIVA strategy by using existing antibodies in hemagglutinin inhibition tests to tell you the vaccine has produced an immune response, and you can also do surveillance with existing techniques that measure antibodies against the nucleoprotein, the agar gel or the ELISA test. Therefore, if they're negative, indicates no field virus exposure. If they're positive, you have exposure to a field virus. But there are limitations of how this technology can be used in the field. For example, this vaccine can only be used in chickens and not other species of birds. The birds cannot have had prior immunization with a fowl pox vaccine or prior exposure to the fowl pox vector, or it will inhibit the vaccine from growing properly and producing a good immune response. And finally, this vaccine also requires parenteral administration, so you have the cost of the administration and the labor of its use. The Newcastle recombinant vaccines have some advantages. They can be given by aerosol spray or in the eye drop, which means you can do mass immunization and lower the cost of the immunization process. The vaccine also protects against both avian influenza, for which the gene insert is in, either H5 or H7, depending on which gene was put in, and it can provide protection against Newcastle disease virus, which is very common around much of the developing world. This technology can use the existing serological test as a DIVA for avian influenza as well as Newcastle, but there are certain limitations. For example, you have to know the present antibody status of the birds you are immunizing, because if you have high maternal or active immunity, this vectored vaccine will not grow properly and produce a primary immune response. The vaccines can be obtained from a variety of sources. By far the most common source are commercial vaccines, but generally these inactivated vaccine supplies are limited. Generally there are several months lag to produce in emanating eggs, inactivate and emulsify, and get to the field for use. Most of the companies maintain minimal stocks. They usually manufacture and produce those for a very limited market. But if you look at some of the other technologies, for example, fowl pox, recombinant vectored, it's a tissue culture produced vaccine, so it has a much quicker production time and you can get it within several weeks. The other source of vaccines are through vaccine banks that are developed by various countries or at least regions of countries that can be available for emergency use. Historically, these have been killed vaccines where the vaccine virus has been grown in emanated eggs and the antigen produced, killed, and frozen in storage. Then if a need for the vaccine arises, the antigen is thawed, emulsified, and then administered or distributed in the field for administration. Generally there's a lag of 1 to 2 weeks of time between when the antigen is thawed out to when it can be bottled and shipped and available. There are several very important field application principles that have to be understood. One is the vaccine is very important. In this case, the hemagglutinin content of killed vaccine, the amount of antigen in each dose, is very important, or the infectious titer of a live virus vaccine. In the inactivated vaccine, the oil emulsion system is very critical to produce a very strong and long immune response. There must be good demonstrated quality control by the vaccine manufacturer so there's consistent quality of the vaccine, and when immunized between different batches, there will be a consistent immunity among birds. It should always be recommended to use the full manufacturer's dose and not to cut or reduce the dose that is given to each bird. Proper storage and delivery control must be done. This temperature control is necessary to prevent degradation of the vaccine, which would be an inferior vaccine for use in the field. And then there must be data to show that the vaccine provides protection against the candidate field avian influenza virus. Administration is the primary goal, and the goal is not the actual injection of the vaccine, but the goal really is immunity. So therefore, the skill of the vaccinators is very crucial. They must provide the high-quality vaccine consistently in the correct anatomical site in order to produce a protective immune response. In the vaccinated population, there must be an adequate number of birds immunized to decrease the potential for an infectious cycle to be originated. Generally, the goal is a 90 to 95% immunity within that farm or that zone or that compartment. In this case, we need both high levels of immunity in individual birds as well as population immunity. And the last thing on the administration is that the administration of the vaccine or the vaccination program cannot be viewed as a single administration program. If vaccination is undertaken, it must be realized that multiple vaccinations must be done when naive birds are added to the population. But there must be developed an exit strategy of how the vaccine will be administered, the types of birds, and the length of time. In administration, you must know the species of bird that the vaccine will be used in and the length of life for those individual production birds. This will impact the number of doses of vaccine that each bird will need in order to produce protective immunity. For example, in ducks and geese, there's a minimum of 2 doses to produce sufficient immunity to last for their lifetime. In turkeys, it may take 2 or more doses in adult turkeys to provide protection. Chicken layers and breeders, because of their long life, may need 2 doses. But if you look at meat chickens, generally 1 dose will be adequate unless there are circumstances suggesting that there is excess exposure. In all situations, biosecurity must be practiced because the vaccination crews can also spread virus from farm to farm. Therefore, high-level biosecurity, decontamination of vaccination equipment, decontamination of clothes and shoes and vehicles must be practiced when leaving a farm after vaccination or before entry upon another farm. Environmental factors do impact the success of vaccination. For example, we must know the immunologic competence of the birds. Control must be made for viruses, bacterial, or other conditions that cause immunosuppression, such as infectious bursal disease virus, or chicken anemia virus in chickens, or hemorrhagic enteritis in turkeys. We must know the virus load in the environment. If there is high environmental load of the virus, it may require additional immunizations to keep the immunity at a very high level and provide protection. If we have high-path AI outbreaks within vaccinated flocks, this may tell us that the number of immunizations is insufficient or the titer of immunity is too low, and therefore more doses may need to be used and boosted more often. And finally, because these are viruses that may be around in the field circulating for long periods of time, there should be periodic testing of emerging field viruses against the existing vaccines, generally every 2 or 3 years, to assure that the vaccine is still protective against the field virus. If new viruses emerge that are no longer protected by the existing vaccines, the vaccine strains need to be changed to provide protection. There must be ongoing assessment of the field vaccination program to determine both the immunization success, which is usually done by serologic titers, most frequently by hemagglutination inhibition titers, to show that there is sufficient antibody being produced in the birds and providing long enough titers that they protected for their production life. Or there must be protection studies done that allow challenge of vaccinated birds against the field virus and show demonstration of protection. There also must be continual evaluation of the assessment of the vaccine success by looking for evidence of infection, either serologically using a DIVA strategy or virologically by a variety of methods. And finally, in this vaccination strategy, there needs to be a concept of a quantifiable either zone, compartment, to determine if the vaccination population is being contained or you have introduction of non-vaccinated animals. The conclusions for this presentation on goals of vaccination: first, vaccination should be used as a single tool in a comprehensive control program. Second, humoral immunity to the hemagglutinin protein is the primary protective response and is specific for an individual hemagglutinin subtype. There are 4 different vaccine technologies used in producing experimental as well as field avian influenza vaccines. They are inactivated avian influenza virus vaccines, vaccines that are produced by in vitro expression of the hemagglutinin protein, either in a tissue culture system or potentially in embryonated eggs. Third is in vivo expressed hemagglutinin protein, usually by vectored bacteria or viruses. And fourth, DNA or naked DNA vaccines. The fourth conclusion: ideally, field avian influenza vaccines should be licensed, and thus they must have demonstrated purity, safety, efficacy, and potency. Fifth, always plan ahead. Develop the avian influenza control program before the outbreak begins, and that should include determination of when and how to do a vaccination program. There are very specific goals of vaccination program against avian influenza. 1 is it increases resistance to infection. 2, it prevents disease and death. 3, it reduces virus replication and shedding from the respiratory and alimentary system, and therefore decreases environmental contamination by the virus. 5th, this reduces transmission to birds. And 6th, it finally prevents human infections. Decisions to vaccinate for avian influenza should be based on evaluation of the needs and the development of a proper plan for vaccination. Thank you for your attention.